Macquarie University Health Sciences Centre will be an integration of traditional faculty of a university with a teaching hospital and clinic that has a big focus on the academic mission as well as providing clinical services.
I think the great advantage of Macquarie University Health Sciences Centre is that we're able to bring under one roof and one management clinicians, teachers and researchers working very closely together on the same block of land and in a very focused way.
Macquarie University Hospital opened 5 years ago, and in that time we've formed a really important part of the development of medicine on the campus.
So the Health Sciences Centre has a mission to heal, learn and discover, and we have a very patient focus in our activities. Our vision is that we will have a facility that provides the absolute top edge clinical care to our patients.
Clinical excellence that will really impact on patient outcomes, that will really allow the patient to be treated by a group of experts where the focus is making them well.
We see that research is right at the centre of our patient-centric care, that if you're not actually researching these conditions, you're not doing the best by the people that you're looking after.
The patients are the focus of everything we do. It's why we're here. And in making that our enterprise successful, we really need to understand what the patients and their carers require.
If you have patient-centric care in any aspect of medicine, it's always better for patient management and patient outcome.
We've spent a lot of time having a discussion with our staff, our leadership, about the values that we hold dear, and these values are really critical for an organisation.
The point of difference is how we interact, how we work together, and the culture and values actually articulate that from the individual right through to the teams of people, right through to the whole organisation and the success.
So one of our values is caring, and we really see that here at Macquarie, not only the nursing staff towards the patients or the doctors towards the patients, but we care for our team as well. So the nurses, the allied health, the doctors are all very caring of each other, and that is quite obviously displayed onto the patients. A lot of feedback from the patients are that we are a very caring team within the intensive care, but also within the whole hospital.
Another important value is integrity. And so honesty and integrity should guide all our behaviours, both individually and as an organisation.
I look after people how I would expect to be looked after if the roles were reversed.
In an academic health science centre, we're really looking at creating something quite different. There's nothing else in Australia like that. And it's the team of people who work together who'll make that successful.
Ambition. We thought a lot about that and exactly what word we would use. But I like it because it means that we're really striving the whole time for the very best, for getting the best staff, for doing the best research, for getting the best care for our patients.
So we're involved in innovation in imaging. We're involved in innovation in our approach to research in motor neuron disease and Parkinson's disease, where we partner with our patients to understand these diseases.
Another important value is engagement. And engagement means that all the work we do is embedded in our patients, but also in our partners. So we believe that by working with people locally and with people across the world, across Australia, wherever, we can achieve better clinical outcomes for our patients and for our students than if we work alone.
There is nothing to stop us here. We can do whatever we dream of doing.